Let's take a look at policy 3301. This is our drug and equipment list. I'm going to hit Control F, type in chest. That search will bring me down here to the needles for needle chest decompression. Notice that we no longer call this needle thoracostomy, but needle chest decompression. Notice that the 20 gauge IV catheter is no longer on the list. For pediatrics, we only have the 18 gauge catheter, and it's now required equipment for the paramedic. Also required is the 14 gauge catheter. And the 16 gauge catheter remains an option. Related to this, let's look at policy 4301. This is the policy for shock due to trauma. I'll scroll down here. Notice here under emergency stabilization or patient management, we have this order. Perform unilateral needle chest decompression for signs and symptoms of tension pneumothorax with rapidly progressing respiratory distress, unrelieved by less invasive means. This is a standing order for the paramedic. Immediately following that, under traumatic arrest, we have this order. Perform bilateral needle chest decompression for cardiac arrest with known suspected torso trauma. That's a standing order for the paramedic. Let's look too at policy 4406. This is cardiac arrest. So there we find our H's and T's, and immediately after that we have the bicarb order. And now we have something new. Perform bilateral needle chest decompression for cardiac arrest with a presentation suggesting spontaneous pneumothorax. This is a standing order for the paramedic. Let's look at policy 7306. This is the performance standard for needle chest decompression. As you can imagine, this performance standard has been completely revised, and you'll be receiving more training on needle chest decompression. I'll hit the highlights here. Prior to needle chest decompression, you assess the patient. Recognize the signs and symptoms listed here. Treat hypoxemia. Recognize and correct confounding factors. And then confirm the indication for unilateral needle chest decompression, or confirm one of the indications for bilateral needle chest decompression. You would assemble your equipment. Identify and aseptically mark the appropriate sides, approaches, and insertion sites. Notice we now have the anterior approach, the anterior lateral approach, and the lateral approach. So this will be the second or third ICS at the midclavicular line, the fourth or fifth ICS at the anterior axillary line, and the fourth or fifth ICS, intercostal space, at the mid-axillary line. To prepare your site, you perform needle chest decompression. Notice too that not only is there an instruction for if air is released, but there's an instruction for if air is not released. Note that if air is not released, repetition of the procedure may be indicated. We have our critical success targets, system benchmark, applicable protocols, competency and proficiency standards, the equipment requirement, the instructor resource materials, and then the validation sheets. Please see your education and training department for more information on needle chest decompression. And please continue with our playlist.